I'd like to call the Health and Human Services and Aging Committee to order. Can we have a roll call, please?
Calling the roll, Ms. Conwell.
Here.
Mr. Tuma.
Here.
Ms. Baker. Ms. Baker is absent at the moment. Ms. Brown. Here. Mr. Miller.
Here.
We have a quorum.
All right. Clerk, has anyone signed in for public comment related to the agenda?
No, Madam Chair.
All right. Do we have anyone signed up for after?
Yes.
All right. Can I have a motion to approve the minutes for March 8th meeting?
Second.
Moved and seconded. All in favor say aye.
Aye.
Minutes are approved. We have two items and they are related and they are from the Office of Child Support. Chrissy, if you could read the first item into the record, please.
Resolution 2017-0052, authorizing Title 4D cooperative agreements with various providers in the total amount not to exceed $11,696,886.76 for child support services for the period 1/1/2017 through 12/31/2017 as printed on the agenda.
Thank you. And who is here today? I believe it's the director.
Good afternoon, Chair Conwell and members of the Health and Human Services and Aging Committee. I am Deborah Watkins, the Director of the Office of Child Support Services, and I am here to talk and address both of these items on the agenda. May I include comments for both?
You can.
Together? Thank you. On behalf of the County Executive, the Department of Health and Human Services, and the Office of Child Support Services, we are submitting 5 Title 4D cooperative agreements for your consideration and request approvals of Resolution R 2017-0052 and R 2017-53. Annually, these cooperative agreements are presented for approval. Title 4D cooperative agreements are mandated by the Ohio Revised Code 3125.14 and the Ohio Department of Jobs and Family Services regulations in order to specify the services which will be rendered pertaining to the establishment, modification, and enforcement of child support obligations in accordance with applicable child support regulations. The federal government has recognized the value of allowing for federal child support funding to be used to reimburse the county for the provision of these services to support Title 4D child support services. To accomplish this reimbursement and to assure that services are provided, counties are required to enter into Title 4D cooperative agreements. The Title 4D contract enables the county to recover nearly 66% of the cost of the services provided through federal financial participation. For all of these contracts, this brings just over approximately $7.8 million back to the county general fund. The cooperative agreements are with county partners, including the prosecutor's office, the domestic relations court, juvenile court, and the treasurer's office. Each of these partners provides services in Title 4D child support cases. These services include the provision of legal services for child support cases, the issuance of judicial orders, and the collection of cash payments for the child support obligations. In addition, we are requesting that these agreements be approved by council following their second reading at the March 28th meeting. And I would be happy to answer any questions that you have regarding these agreements. Thank you.
All right, just housekeeping. You stated, Director, 66%, but the actual legislation says 61, and then the actual figure in the legislation is 7.1 million and some odd change, but you stated 7.8. Is that do we need to change the legislation?
No, I was speaking with our financial representative here today. The federal financial participation is 66% reimbursement. The way that it is written in the resolutions, it is fine the way that it's written because they do take program income off, which is the revenue fees ahead of applying for the 66%. But the federal financial participation rate is 66%. And we do anticipate that if the contracts are actually fully spent, that it will return that to the county.
All right, any questions from committee? I just,
Go ahead.
Councilman Miller. Sometimes I leave.
Madam Chair, Ms. Watkins, can you tell us what the trend is in terms of the amount of child support being collected in Cuyahoga County and also as far as the rate of collection percentage is concerned?
Yes, through Chairwoman Conwell to Councilman Miller. Yes, at the end of 2016, child support in Cuyahoga County had collected approximately $238 million for the families that it serves. We are currently increasing our rate of payment of current support collections. We are currently at just over 62% of all current support owed is paid during the month that it is owed. It is paid during the month that it is owed. In addition, though, we are seeing some decline in our caseload. So there is some decline in the total dollars being collected through the Office of Child Support Services. So right now we are at about 124,000 cases, and several years ago we were at just over 155,000 cases.
And Madam Chair, Ms. Watkins, you said that 62% of child support owed is collected in the month that is owed. What additional percentage is eventually collected?
That is a fantastic question. I am not sure that I have those figures broken down into percentages in my head, so I don't I don't have the percentages here today to answer that particular question.
Could you find out and let us know?
I absolutely would be happy to do that.
And Madam Chair, Ms. Watkins, can you give us some information on how that 62% current collection rate compares with what is seen in other jurisdictions around the country?
Through the chairwoman to Councilman Miller, yes. I unfortunately did not bring the exact numbers here with me today. However, if I remember correctly, I believe that the national average is somewhere around 55% of current support is collected during the month that it is owed. The state of Ohio is last year achieved, if I remember correctly, approximately almost 70% of current support was paid during the month that it was due. There are several jurisdictions within the state of Ohio that are substantially above 70% of collecting current support in the month that it is due.
And how does that 62% number compare with what it's been in Cuyahoga County in the past? Is that percentage increasing, decreasing, or staying about the same?
That percentage is increasing, and I can see the chart in my head. We are, a couple of years ago, we were at about 60% of current support was paid during the month that it was due.
And final question, in an ideal world, what's the best number you think we could get?
I would like to be at least 70% of the current support collection. I do believe that bringing in some modern technology and the ability to bring in a case management system would increase our ability to collect additional child support during the month that it is due. Ultimately, the federal government has a goal of making sure that child support agencies are collecting approximately 80% of the current support obligation during the month that it is due. That goal is a very aggressive goal. Ultimately, we would like to see closer to 100% of all child support paid during the month that it is due, because that's when child support is paid on a regular and consistent basis, that's when there are substantial benefits and positive outcomes to children when support is paid on a regular and consistent basis. So for all children in Cuyahoga County, we would like to see that child support is paid on a regular and consistent basis.
Thanks, Madam Chair.
All right, just to follow up on something you stated earlier, you said we currently have a 62% of collections, an increase, but then you mentioned some decline in caseload. What is that decline attributed to?
Chair Conwell, the decline is, it is a national trend. There is a national decline in the child support caseload across the nation. Some of that decline is caused by a change in the referral systems. So as we see public assistance decrease, or the number of parents receiving public assistance decrease, that decreases the number of cases where parents are mandatorily required to comply with child support services. And in addition, several years ago, there was a change made to cooperation if a parent was receiving Medicaid. And so those cases are not automatically coming and resulting in an opening of cases. So a substantial portion of the decline is actually in direct relation to the decrease in public assistance. In addition, it is important for child support to continue to modernize, to be relevant to the modern family, so that as we see parents who are living separate and apart, that they see the value and the benefit of utilizing child support services.
And this is just off the cuff, but since we're on that topic, would it actually be more beneficial if we could get equally shared parenting? Would that, I think that would be better for the child, but would that have some direct impact on us being able to get reimbursement dollars? And just reading some various articles and lately of how people look at that, it was set up because most females are get the children, and most of them will probably be unemployed, and it would go into TANF and welfare dollars. So just wondering if we could move toward that.
Chair Conwell, we certainly in Cuyahoga County support parenting time opportunities for children. The Office of Child Support Services here in Cuyahoga County recently, or as of December of last year, or December of 2015, started participating in a federal grant where we can actually offer parents the ability to obtain a parenting time order, or what was formerly known as visitation, at the same time as they establish their administrative support orders. All of the research shows that by supporting parenting time opportunities for children, as long as it is safe to pursue those opportunities, that there's direct benefit to the child in terms of positive outcomes, both in terms of improvements in the life of the child, as well as engaging parenting on both sides, and that also leads to an increase in the current child support that is paid. So we certainly support that. The determination of whether that should be equal, a 50-50 division of time, that's a question for debate. And you are, as you pointed out, there is a lot of conversation regarding that particular topic at this time.
You stated increase in the child support payment, but I would actually, my mind is thinking that if they had shared parenting, it would actually maybe possibly decrease for the non-custodial parent in terms of payment of what they would have to pay, because they actually have time with that kid and they're probably spending money with that kid when they...
Presumably, yes, and typically at if it is equally divided time, you typically do see the courts deviating the child support payment to see a reduction in the child support to account for the additional time that's being spent. It also highlights, if I may, an important reason for why the child support guidelines, which are current proposals, were in the Ohio legislature last year and will hopefully be reintroduced this year, regarding updating and modernizing the child support guidelines. It's currently, the child support guidelines assume that 100% of the expenses are expended in the home of the residential parent, and also the current guidelines are based on economic data from the 1990s. So it is important that those guidelines legislation would be passed hopefully this year. And in addition, some of the new proposals will allow for a little more flexibility as far as parenting time.
I did, to my colleagues, I did ask the director, as soon as that legislation gets passed, that she lets us know. That will be a good thing, because that would actually provide more funding for the child. You know, it might be more payments that they're paying, but they're not getting the full benefit of what they should be getting. Open up, any other questions? All right, then might have just a couple more. Are these cooperative agreements usually done on an annual basis?
They are done annually, yes.
Okay. And can you just share explain how the dollar amounts for each agreement is determined?
Yes, there is a substantial formula that we utilize to determine those. The short answer is that we look at the budgets based upon the units of service. So for our contracts with our courts, the contract is based on the number of filings that are completed. So we pay for the number of filings, and we calculate the cost of those filings based upon the costs involved in the space that's utilized, in what it costs them to produce that filing, the time that's spent from the various court personnels. So for the court contracts, it's based on the number of filings. For the prosecutor's office, the contract is based upon the number of hours that the prosecutor's office is spending directly providing child support services. So it can only cover the cost of child support services, but it is a fairly extensive process that we go through in order to calculate all of the budgets. For the two smaller contracts from the treasurer's office and the juvenile court, those are to reimburse both of those organizations for collecting cash child support payments at their locations. And so it reimburses part of their costs for their personnel and supplies and space in order to provide that service for our cases.
And were the last year's figures higher or lower?
Some of both. So we are seeing approximately a 5.71% decrease in the domestic relations contract, approximately a 4.25% decrease for the Division of Juvenile Court, approximately a 3% increase in the prosecutor's office contract. The treasurer's office is approximately a 10% increase, and the juvenile court cash payments is about a 14% increase. It's actually, for that one, the percentage of increase sounds large, but it's actually only a $4,000 increase. Last year was the first year that we actually engaged in the contract with juvenile court to collect cash payments. So last year we didn't have quite as much actual data to base the contract on. So this is our second year. We have much more data in order to go off of this year.
Okay, since you said that basically this is a reimbursement for space utilized in time, I see that Employment and Family Services building is not being reimbursed. They just started the cash payment, child support cash payment. So
Yes.
is that because you're housed and you already pay rent? Is that
Yeah, we are part of one Health and Human Services organization, so yes. And yes, you are right, we have added that additional option for parents to pay their child support this year as well.
And I just think there's one final thing that I didn't understand. So the reimbursements in the legislation, it talks about the different reimbursements of funding. I wasn't quite sure about the revenue fees. What revenue fees?
Sure. The revenue fees that we collect on every child support payment that is due, the parent who pays child support is expected to pay a 2% administrative fee. And so the revenue fees are the 2% administrative fees. And the administrative fees that we collect in child support cases is considered what we call program income. And so when the parents pay those fees have to be taken off of our expenditures first before we can apply for any federal reimbursement.
Okay. Any further questions from the committee? Hearing none. Well, thank you very much, Director, for your time.
Thank you.
And we look forward to updates.
Thank you.
Now we didn't read the second one, so Chrissy, if you can, we'll do two quick votes, but if you can read the next item into the record. And I'm assuming that the director would need second reading suspension on these. I think we talked about that.
Resolution 2017-0053, authorizing Title 4D cooperative agreements with various providers in a total amount not to exceed $103,746.55 for child support services for the period 1/1/2017 through 12/31/2017, as printed on the agenda.
Can I have a motion for the first item, 0052?
Also move and with recommendation for second reading suspension.
Second.
Moved and seconded, all in favor say aye.
Aye.
For 0053, if I could have a motion, please,
So moved.
Second.
for second reading suspension?
Yes.
Is that the motion? All in favor say aye.
Aye.
Thank you. And any miscellaneous business, anything anyone needs to bring up? Anything from the administration? All right. Our other public comment?
Yes, first, Mr. Nathan Manthe.
Hello.
Good
Green
afternoon.
button?
Hi. So recently I attended a homeless Congress meeting, and at that meeting, Ruth Gillette, the director of the Office of Homeless Services, was able to answer questions for why Frontline Services was given the recommendation to continue contracting with Norma Herr Women's Center. And a lot of the women had trouble understanding why the committee that conferred and decided for that recommendation didn't consist of any current or former homeless individuals. They didn't have direct access to the grievance reports that were filed from the residents staying at the women's shelter. They also weren't able to talk to any of the women staying at the shelter to assess the quality of one of the criteria, which was to be maintaining a safe shelter, currently a safe shelter. So what was given in defense was that is standard county procedure on deciding about those petitions and those contracts, and that is the way the county proceeds with those things, and that it wasn't up to her. It wasn't up to Ruth Gillette to allow those issues to be brought up. So what I wanted to know, and I included contact information with my form because I do want to know from the committee if there's a possibility that when it comes to human services contracts, that the services and the humans that you're providing the service to can be included with those bids, because the idea that safety was brought up is a qualitative concern, and it seems like the best way to assess the safety of that shelter and to talk about how to better human services in those contracts is to involve the patients that you're working with. So I would just like some clarity on that issue. Thank you for your time.
And your name is Nathan?
Nathan Manthe, yes.
Manthe?
Manthe, yeah.
Okay, we usually don't respond back, but we will make sure that someone gets back to you, but we do not know the dates yet. We are in the planning stages, but there will be some community forums, cafe-type forums, where the individuals in the community will actually participate in a Department of Health and Human Services plan. They will give feedback, and I think that would be a great opportunity. You can watch our website. We'll definitely, once all those dates are confirmed in the various communities, I think it'll be 5 or 6, you should be able to participate at one of those locations and bring that information up.
All right, thank you for your time.
You're welcome.
Last is Ms. Lou.
Good afternoon.
Good afternoon.
I'm glad to be here, and I heard some more new information. The previous person just mentioned about a safety issue, and I found out recently for sure. The safety issue is not only in the women's shelter, it's also in the men's shelter. It's the same. The past Monday, for example, they had a physical fights throughout the evening, from the dormitories to the bathrooms, back to the dormitories, same thing. So if none of the service provider can really have a trained staff to calm people down, to really talk to them, to rationalize with them, to offer some resources for them to get help. Doesn't matter how this bid is finished, both shelters will still not be safe. The other safety issue is from, for example, food poisoning, those type of things. This is the dinner I got March 17th. For diabetic people, this could be a little bit too starch. Even the portion is small because that's the only thing served. However, the other night, I just found out. Finally, we know the name of that dish. Chicken paprikas. Paprikas. Surprisingly, it's a whole tray of it. Wasted. Oh, just to let you know how it was wasted. In the open space area. The problem here is, if you really want to talk about cause and effect, why would county wants to keep paying the service provider mismanage their bad employees, even just few of them, to do all these things? They don't want to serve the food in the better quantity. They refuse the food to give out to pregnant residents who cannot control their appetite. They don't want to give out the food to the people who need to take the food with their medication, prescribed by their doctors with the specific notes. Because these few, they don't like to do extra cleaning work. Yes, in any kind of a contract, probably there will be no details stating to this degree, but it's a health and human services. We are talking about lives. So if you want to treat us like numbers or some boxes in the warehouse, it will not work. But if something bad really happens later, guess what? General public will point a finger at you guys because they don't know anything about any service providers. Thank you.
Thank you. Any other business for today?
No, Madam Chair.
Meeting is adjourned.